Good day everyone. Today, we will be reviewing some practice questions about antifungal agents. Question number 1. These are the drugs which can kill or inhibit the growth of the fungus in the body of the host. A. Antibiotics. B. Antifungal agents. C. Antiviral agents. D. Antiseptics and disinfectants. The answer is letter B. Antifungal agents. Because antifungal agents is a pharmaceutical fungicides or fungistatic used to treat fungal infections. For the question number 2, some of these agents may also be useful in treating dermatomycosis via blood and interkeratin producing cells in the skin. A. Topical agents. B. Antiviral agents. C. Systemic agents. D. Antiseptics and disinfectant agents. The answer is letter C, systemic agents, because these are used in the treatment of internal or GIT fungal infections. For the question number 3, these agents are used for the treatments of superficial fungal infections, usually applied topically. A. Topical agents. B. Antiviral agents. C. Systemic agents. Or D. Antiseptics and disinfectant agents. The answer is letter A, topical agents. Topical agents used to treat superficial fungal infections like ringworm. Question number 4. A topical agents active against most dermatophytes and administration orally for treatment of ringworms in dogs, cats, calves, horses, and other domestic animals. A. Benzoic acid. B. Cyclopyroxolamine. C. Salicylic acid. Or D. Grisofolbin. The answer is letter D. Grisofolbin. Because this drug is effective for the treatment of ringworms in the said animals and also classified as topical antifungal agents. For the question number 5, a large number of antifungal agents are also applied topically on the skin, in the air or eye, or on the mucous membrane to control superficial, local fungal infections. Classify these drugs as A. Anticyclinic acid. B. Benzoic acid. C. Salicylic acid. Or D. Grisofolbin. Answer is letter A. Anticyclinic acid. Anticyclinic acid has potent fungistatic activity and it is used in superficial fungal infections and to treat fungal mastitis. For the question number 6, which of the following is not belong to the polyolin antifungal antibiotics? A. Amphotericin B. B. Imidazoles. C. Nystatin. Or D. Natamycin. Answer is letter B. Imidazoles. Because imidazole is classified as azoles. Question number 7, also known as pimaricin. A. Amphotericin B. B. Imidazoles. C. Nystatin. Or D. Natamycin. Answer is letter D. Natamycin. Natamycin is the other term of pimaricin. Question number 8. This agent is obtained from a strain of Streptomyces nodosus and active against a wide range of fungi. A. Amphotericin B. B. Imidazoles. C. Nystatin. Or D. Natamycin. Answer is letter A. Amphotericin B. Because this drug came in the strain of Streptomyces nodosus and used to treat fungal infection like histoplasmosis, blastomycosis, coccidioidomycosis, cryptococcicosis, and candidiasis. For the question number 9, obtained from Streptomyces nodosi, and these drugs of choice for prevention and treatment of intestinal moniliasis. A. Amphotericin B. B. Triazoles. C. Nystatin. Or D. Natamycin. Answer is letter C, nystatin. Because nystatin is similar properties to amphotericin B and that have the ability to inhibit this kind of infections. Question number 10. Which of the following is not belong to the group? A. Cotrimozoles, B. Iconazole, C. Ketoconazole, or D. Miconazole? Answer is letter C, ketoconazole, because ketoconazole is belong to the group of systemic in imidazoles. Which of the following is the systemic fungal infections? A. Coccidioidomycosis, B. Ringworm, C. Candida infections, or D. Chronic superficial infections? Answer is letter A, coccidioidomycosis, because this disease occur within the body of the host. For the question number 12, which of the following is imidazole's antifungal agents? A. Fluconazole, B. Itraconazole, C. Amorolpine, or D. Clotrimazole? Answer is letter D, clotrimazole, because clotrimazole is classified as imidazoles. Question number 13. This agent also acts as immunostimulant in animal. A. Azoles, B. Grisophobin, C. Amphotericin B, or D. Pimaricin? Answer is letter B, amphotericin B. Immunostimulant are substances that stimulate the immune system by including activation or increasing activity of any of its components. Question number 14. IV administration of which of the following systemic antifungal agents can be used to treat spirotrichosis? A. Sodium iodine, B. Terbinafine, C. Flucloxacin, or D. Potassium iodide? Answer is letter A, sodium iodide. Sodium iodide can be administered intravenously or orally. Question number 15. Which antifungal drugs has a risk of nephrotoxicity? A. Enalconazole, B. Grisophobin, C. Sodium iodide, or D. Amphotericin B? Answer is letter D, amphotericin B. The primary toxicity of this drug is nephrotoxicity. For the question number 16, the definitive diagnosis is difficult owing to the A. Slow and fastidious nature of fungal growth, B. Clinical signs mimic those of the other disease processes, C. Clinicians do not initially consider fungal etiologic agents, or D. Slow and fastidious nature of bacterial growth? Answer is letter A, slow and fastidious nature and fungal growth, because it is considered as the primary difficulty in definitive diagnosis. Question number 17. In the reproduction of fungi, which is not belong to asexually reproduction? A. Budding, B. Sporulation, C. Meiosis, or D. Hypalpigmentation? Answer is letter C, meiosis, because meiosis is considered as sexual reproduction. Question number 18. Considered as specialized asexual spores. A. Conidia, B. Ascomycota, C. Ascospores, or D. Asci? Answer is letter A, Conidia, because it is considered as specialized asexual spores and generated through the cellular processes of mitosis. For question number 19, drugs interaction can occur with all azole but are less likely with A. Fluconazole, B. Posaconazole, C. Itraconazole, or D. Voriconazole? Answer is letter A, fluconazole, because drug interaction can occur with all azoles but are less like with fluconazoles. For the question number 20, which of the following is considered the treatment of choice for aspergillus infections in immunocompetent and immunocompromised patient? A. Fluconazole, B. Voriconazole, C. Itraconazole, or D. Posaconazole. Answer is letter B. Voriconazole. Voriconazole is considered as the treatment of choice for Aspergillus infection in immunocompetent and immunocompromised host. For the question number 21, in incubation, what temperature dermatophytes best grow? A. 25 degrees Celsius, B. 27 degrees Celsius, C. 35 degrees Celsius, or D. 37 degrees Celsius. Answer is letter A. 25 degrees Celsius. Dermatophytes best grow in 25 degrees Celsius. Question number 22. Are spores produced by fragmentation of septic hyphae? A. Arthrospores, B. Blastospore, C. Chlamydospore, or D. Conidiospore. Answer is letter A. Arthrospores. Arthrospores are produced by the fragmentation of hyphae into compartments separated by septa. For the question number 23, a spore formed by the budding process. A. Arthrospore, B. Blastospore, C. Chlamydospore, or D. Conidiospore. Answer is letter B. Blastospore. When spore produced by a vegetative cell by budding are called blastospore. Question number 24. Thick-walled intercalary or terminal asexual fungal spore formed by the rounding up of a cell. It is not shed. A. Arthrospore, B. Blastopore, C. Chlamydospore, or D. Conidiospore. Answer is letter C. Chlamydospore. This formation appears to be an integral part of the filamentation process. They could necessarily support sexual sporulation under adverse conditions. For the question number 25, a specialized hyphae that bears or give rise to conidia either singly or in numbers. A. Arthrospore, B. Blastospore, C. Chlamydospore, or D. Conidiospore. Answer is letter D. Conidiospore. A specialized hyphae, simple or branch, on which conidia are formed or which bears conidiogenous cells. For the question number 26, drugs that can inhibit ergosterol biosynthesis at the level of squalene epidoxidase. A. Allylamine antifungal agents, B. Antimetabolite antifungal agents, C. Echinocandins antifungal agents, or D. Morpholin antifungal agents. Answer is letter A. Allylamine antifungal agent. Because the allylamine inhibits squalene epoxidase, important in the synthesis of ergosterol. For the question number 27, these drugs together with amorolfine can inhibit the same path at a later step. A. Allylamine antifungal agents, B. Antimetabolite antifungal agents, C. Echinocandins antifungal agents, or D. Morpholin antifungal agents. Answer is letter D. Morpholin antifungal agents. Morpholin are totally synthetic compounds and with the exception of amorolfine are used as agricultural fungicides. Question number 28. These drugs are a newer type of antifungal drug. They inhibit an enzyme that involved in the making of the fungal cell wall. A. Allylamine antifungal agent, B. Antimetabolite antifungal agents, C. Echinocandin antifungal agents, or D. Morpholin antifungal agents. Answer is letter C. Echinocandin antifungal agents. Because this class of antifungal drugs target the fungal cell wall. Question number 29. a mucosal and invasive candida infections? A. Anidolafungin, B. Casfongin, C. Echinocandins, or D. Mycofungin? Answer is letter A. Anidolafungin, because this medication is used to treat a variety of fungal infections. Question number 30. Which drug is not belong to echinocandins? A. Anidolafungin, C. Casfongin, C. Micafungin, or D. Histoplasma? Answer is letter D. Histoplasma, because histoplasma is classified as fungal infection. For the question number 31, also known as tinea, a fungal infection of the skin that can occur on your scalp, on your feet, or athlete's foot, in your groin area, or jock itch, and on the other areas of your body. A. Nail fungus, B. Ringworm, C. Vaginal yeast infection, or D. Oral thrush? Answer is letter B. Ringworm. Ringworm is a common skin infection that is caused by a fungus and also known as tinea. For the question number 32, an infection that typically affects your toenails but can also affect your fingernails. A. Nail fungus, B. Ringworm, C. Vaginal yeast infection, or D. Oral thrush? Answer is letter A. Nail fungus. Common infection of the fingernails or toenails that can cause the nail to become discolored, thick, and more likely to crack and break. For the question number 33, an infection that occurs due to the overgrowth of candida yeast in and around the vagina. A. Nail fungus, B. Ringworm, C. Vaginal yeast infection, or D. Oral thrush? Answer is letter C. Vaginal yeast infection. Because a vaginal yeast infection is a fungal infection that causes irritation, discharge, and intense itchiness on the vagina and the vulva. For the question number 34, a condition in which candida yeast overgrows in your mouth. A. Nail fungus, B. Ringworm, C. Vaginal yeast infection, or D. Oral thrush? Answer is letter D. Oral thrush. Oral thrush is a condition in which the fungus Candida albicans accumulates on the lining of your mouth. For the question number 35, is an infection, allergic reaction, or fungal growth caused by the Aspergillus fungus. A. Aspergillosis, B. Histoplasmosis, C. Cryptococcal meningitis, or D. Coccidioidomycosis? Answer is letter A. Aspergillosis. Exposure to the fungus doesn't necessarily guarantee that you'll get aspergillosis. Question number 36 is an infection in the lungs caused by the fungus Coccidioides. A. Aspergillosis, B. Histoplasmosis, C. Cryptococcal meningitis, or D. Coccidioidomycosis? Answer is letter D. Coccidioidomycosis. You can get valley fever by inhaling spores from Coccidioides emetis and Coccidioides posadisi fungi. Question number 37 is an infection and inflammation of the meninges, which are the membrane that cover the brain and spinal cord. A. Aspergillosis, B. Histoplasmosis, C. Cryptococcal meningitis, or D. Coccidioidomycosis? Answer is letter C. Cryptococcal meningitis. Meningitis can be caused by different germs, including bacteria, fungi, and viruses. Question number 38 is a type of lung infection. It is caused by inhaling Histoplasma capsulatum fungal spores. A. Aspergillosis, B. Histoplasmosis, C. Cryptococcal meningitis, or D. Coccidioidomycosis? Answer is letter B. histoplasmosis. These spores are found in soil and is dropping of bats and birds. Question number 39. An itchy red rash that appear in your groin area and on your inner thigh. A. Candida. B. Athlete's foot. C. Jock itch. Or D. Blastomycosis. Answer is letter C. Jock itch. Jock itch or tinea cruris is a fungal infection that causes a red and itchy rash in warm and moist area of the body. Question number 40. It is the scaly skin of the bottom of your feet. A. Candida. B. Athlete's foot. C. Jock itch. Or D. Blastomycosis. Answer is letter B. Athlete's foot. Athlete's foot or tinea pedis is a fungal skin infection that usually begins between the toes. Question number 41. Which of the following statements correctly pair with the antifungal drug with their likely mechanism of action? A. Amphotericin B. Inhibit dimethylate synthetase. B. Terbinafine. Inhibit squalene epoxidase. C. Flucytoxin. Inhibits fungal mycolic acid synthesis. Or D. Miconazole. Inhibit DNA-dependent RNA polymerase. Answer is letter B. Terbinafine. Inhibit squalene epoxidase. Terbinafine, also effective mainly against dermatophytes, blocks the conversion of squalene to ionosterol by inhibiting the fungal enzyme squalene epoxidase. Question number 42. Which of the following fungal disease is resistant to azole treatment? A. Coccidioidomycosis. B. Histoplasmosis. C. Aspergillosis. Or D. Mucormycosis. Answer is letter D. Mucormycosis. Azole have a wide antifungal spectrum that includes most fungal species. A notable exception are the agents of mucormycosis or mucor and rhizopus species that are usually resistant to these drugs. Question number 43. Recognized clinical indication for the use of terbinafine include which of the following diseases? A. Actinomycosis. B. Brucellosis. C. Toxoplasmosis. Or D. Onychomycosis. Answer is letter D. Onychomycosis. Terbinafine is an antifungal drug that inhibits the synthesis of ionosterol. It is deposited in cateterized tissue, is used to the treatment of dermatophytosis, mainly onychomycosis. Question number 44. A thick, cheesy vaginal discharge that has been present for 4 days and is not non-malodorous in old female. The yeast cells and pseudohyphae in wet sample of vaginal discharge are in the process of budding. Which drug from the following list out to be given locally to this patient? A. Mebendazole. B. Metronidazole. C. Miconazole. Or D. Zidovudine. Answer is letter C. Miconazole. The symptoms of the patient and the lab results strongly suggest that she is suffering from the genital candidiasis, the most common opportunistic mycosis of genital tract in women taking oral contraceptives. Question number 45. An old male dog were reported with the clinical sign of anorexia, nausea, and impotence. Since receiving a recent diagnosis of pulmonary coccidioidomycosis, the patient has been taking an antifungal drug for 2 weeks. What drug was it most probably that caused this adverse effect? A. Nystatin. B. Ketoconazole. C. Fluoxetine. Or D. Griseofulvin. Answer is letter B. ketoconazole. Ketoconazole is an azole antifungal drug that can inhibit the cytochrome P450 system both in fungal and mammalian cells. For the question number 46, which of the following fungi is not sensitive to griseofulvin? A. Candida albicans, B. Trichopiton rubrum, C. Epidermophyton flocosum, or D. Microsporum gypsum. Answer is letter A. Candida albicans. Candida albicans is not sensitive to griseofulvin. For the question number 47, which of this molecule is present in fungal cell membranes but not in animal cell membranes? A. Cholesterol, B. Beta-glucan, C. Ergosterol, or D. Fluconazole. Answer is letter C. Ergosterol. Fungi have plasma membrane similar to the other eukaryotes, except that the structure is stabilized by ergosterol. For the question number 48, most antifungal agents bind more avidly to ergosterol than cholesterol, thus more selectively damaging fungal cells than human cells. True or false? Answer is letter A, true. By binding to or inhibiting ergosterol synthesis, they increase the permeability of the fungal cell membrane, causing cell lysis. For the question number 48, true or false? Proxytocin does not cross the blood-brain barrier, so it must be given enterically to reach the cerebrospinal fluid or CSF. A. True or B. False? Answer is letter B. False. False. Because amphotericin B does not cross the blood-brain barrier. Proxytocin penetrates CSF well. For the question number 50 or the final question, most fungi are resistant to proxytocin except for Cryptococcus and Candida. A. True or B. False? Answer is letter A. True. Proxytocin use is mostly limited to cryptococcal meningitis in conjunction with amphotericin B. That's all and thank you.